Streptococcus pyogenes, also known as necrotizing fasciitis, a flesh-eating disease. Please be advised, there is graphic content beyond this point. 3 stages of necrotizing fasciitis. In the first picture to the left, that is a picture pre-diagnosed or treated necrotizing fasciitis. The middle picture is a case of necrotizing fasciitis where debridement has happened. The third photo to the right is a healed leg post-debridement of necrotizing fasciitis. Transmission of necrotizing fasciitis can be caused or transmitted via cuts, scrapes, burns, puncture wounds, surgical wounds, or insect bites. Necrotizing fasciitis can occur at any body part, however, most commonly found in the extremities, perineum, or genitals. The epidemiology of necrotizing fasciitis is as follows. The fatality rate is between 11 to 30%. The mortality rate is 15%. And 28% of patients being admitted to hospitals for necrotizing fasciitis are diagnosed with necrotizing fasciitis pre-admit or suspected to have necrotizing fasciitis. Necrotizing fasciitis can be masked with many other diagnoses. However, they do always keep necrotizing fasciitis on the table so they can do more tests in depth and make sure to rule out necrotizing fasciitis or any other diagnosis properly. Patients with diabetes, kidney disease, and cancer are more likely to get necrotizing fasciitis due to their immune systems being compromised. Some symptoms that do go along with necrotizing fasciitis is a red, warm, or swollen area of skin that spreads very quickly, which includes pain in that area or beyond that area. Fever, blisters, fluid collection, and numbness and or sensation in that area of swollen skin. Some wound care and infection prevention, which will minimize your infection rate and hopefully avoid ever being diagnosed with necrotizing fasciitis, would be when noticing a wound or getting a wound, you would wash the wound immediately with soap and water, apply a small amount of antibiotic ointment, cover the wounds with a bandage or gauze dressing. Always keep the wound dry and clean for the first 24 hours minimum. Wash your hands before and after caring for the wound, and change the dressing of the wound daily. If the wound does not progress to healing, please contact a doctor immediately, and no wound is ever too small for this infection. So even if it's the smallest, slightest wound, scratch, scrape, always make sure you care for it properly so it does not progress into something more serious of an infection that can cause a life-threatening infection. The diagnosis for necrotizing fasciitis, they would take a tissue sample and do a biopsy. They would analyze some blood work. They could do imaging such as a CT scan, MRI, ultrasound of the damaged area, and also a gram stain, which you can see to the in the photo. Treatment for necrotizing fasciitis does require hospital care. They do try and do strong antibiotics via IV as an antibiotic therapy, pre-debridement of the dead or damaged skin and tissue. They do always begin with the antibiotics normally during pre-op for these surgical debridements or amputations, debating on how far the infection has progressed. Always catching necrotizing fasciitis in a quick manner is ideal, because once it has advanced past a certain point, it does become more life-threatening. The prognosis of necrotizing fasciitis. The mortality rate of necrotizing fasciitis ranges from 24% to 34%. Necrotizing fasciitis and streptococcal toxic shock syndrome have mortality rate of 60%. Those do go hand in hand sometimes, where there is an underlying diagnosis or another infection that does come about after necrotizing fasciitis has been diagnosed. In a study in 2010, I believe there were 377 patients, in which 345 survived at least 30 days. 12 of the 87 deaths were due to an infectious case, and women did have a higher mortality rate during this case study. Common complications with necrotizing fasciitis are renal failure, septic shock with cardiovascular collapse, scarring with cosmetic deformity, which I did show in the second slide as the last photo, limb loss, sepsis, and toxic shock syndrome. Some fast facts about necrotizing fasciitis. Since 2010, approximately 700 to 1,200 cases occur every year in the United States. 1 of 3 cases who contract this infection do die from this infection. Streptococcus group A, which is the Streptococcus in necrotizing fasciitis, is also the same bacteria known to cause strep throat. The blood supply to the infected area becomes impaired, making it unavailable to fight the infection or also get the required antibiotics to the infection to fight the infection, which is why in most cases necrotizing fasciitis does end up with surgical debridement or amputation. And here is my final resources if you guys would like to look into necrotizing fasciitis anymore. Thank you for listening and have a good night.